Hi dear friends, welcome to Medbits, your exam savior. Today, as usual, let's discuss another very important topic from physiology, that is GFR or glomerular filtration rate, and how is its regulation. Let's look into the definition of GFR. Glomerular filtration is the first step in making urine. It is the process that your kidneys use to filter excess fluid and waste products out of the blood into the urine collecting tubule of the kidney, so they may be eliminated from your body. The first step in making urine is to separate the liquid part of blood known as plasma, which contains all the dissolved solutes from blood cells. Each nephron in kidney has a microscopic filter called a glomerulus that is constantly filtering the blood. Now let's look into the glomerular filtration diagram. You need to please learn how to draw this and label. Here you can see that the blood is entering from the cortical radiate artery to the glomerular capsule, and the entry is through the afferent glomerular arteriole, and then these capillaries are subdivided into glomerular capillaries, and after that how the blood is going out of this glomerular capsule, that is through the afferent glomerular arteriole, and then it is going to the cortical radiate vein. And here in the image you can see that this is the point where the glomerular filtration is happening. And here you can see the tubular reabsorption and then secretion also happening. Now let's discuss about the glomerular filtration rate known as GFR. GFR is the rate at which filtrate is formed in all the nephrons in a minute. GFR is 120 ml per minute, or if it is in a day, let's say it is 180 liters. This is known as the GFR rate of a healthy person. And why should we find out GFR? That is the answer given here. GFR is the efficient way to identify kidney health function. Glomerulus are the structure-like balls of blood capillaries we have just seen in the previous slide. 2 millions of glomerulus filter about 3 to 4 liters of blood in just 5 minutes. You can have a look into this diagram. See, 120 is the GFR rate of a healthy person, and you see up till 60 is considered as a normal healthy category, and a kidney disease is diagnosed when the GFR rate falls between 60 to 15, and in case unfortunately if the GFR is below 15, we call it as a kidney failure. Now let's see the factors influencing GFR. As you can see here, GFR is calculated by an equation. GFR equals filtration coefficient multiplied by net filtration pressure. The net filtration pressure is determined by 3 factors. Number 1 is, please have a look into the diagram. It's shown here clearly. See this one. This is the capillary hydrostatic pressure. And the second factor affecting GFR net filtration pressure is the colloidal osmotic pressure. And the third one is Bowman's capsule pressure. And we will go in detail about these 3 different types of pressure in the coming slide. Now let's look into the 3 factors which is affecting the net filtration pressure. Number 1 is capillary hydrostatic pressure. The GFR is affected by the afferent and efferent arteriolar resistance and the renal artery pressure. Let's look into the case when the afferent arteriole diameter is increased. Okay. In case if the afferent arteriole is the arteriole through which the blood is entering to the glomerulus or to the Bowman's capsule. In case if this diameter is increasing, what happens? Naturally, the resistance is decreased. And then what happens? It helps to increase in the glomerular capillary hydrostatic pressure, and hence the GFR also increases. Which means if the afferent arteriolar diameter is increased, and that helps to increase the capillary hydrostatic pressure. If the capillary hydrostatic pressure is increased, then the GFR also is increased. And its opposite case also can happen. Suppose the afferent arteriole diameter is reduced. In that case, the resistance increases, and then naturally the hydrostatic pressure will reduce, and then the GFR will be lowered. These two cases we talk about afferent arteriole. Now we can look into the case of efferent arteriole. What happens? In case of the efferent arteriole, diameter is increased. If the diameter of the efferent arteriole increases, there also when the diameter increases, that helps to decrease the resistance. In this case, if the diameter is increased, then the glomerular capillary hydrostatic pressure is decreasing. And if the hydrostatic pressure is decreasing, naturally the GFR also will be decreased. And its opposite also can happen. That means in case if the efferent arteriole diameter is reduced, in that case what happens? The resistance of the arteriole increases, and at that time the glomerular capillary hydrostatic pressure can increase, and hence the GFR also can increase. Hope you got it clear. Now let's look into the other factor which is affecting the net filtration pressure. As we said before, that is colloidal osmotic pressure. What is colloidal osmotic pressure? It is the pressure exerted by plasma proteins and colloids in blood. GFR is opposed by colloidal osmotic pressure. Dilution of blood, please remember these points. Dilution of blood or hypoproteinemia reduces the osmotic pressure. Now we are going to the third factor affecting the net filtration pressure, that is the Bowman's capsule pressure. Bowman's capsule pressure is the hydrostatic pressure exerted by the fluid present in the Bowman's space. This pressure also opposes glomerular filtration rate. There is one more factor which affects the GFR rate, that is the thickness of membrane. GFR is inversely proportional to thickness of membrane. That means greater the thickness of membrane, smaller is the GFR. We know that very well, right? If you are trying to filter something with a heavy cloth, we are not able to filter it totally. But if the cloth is of very thin layer, definitely we can filter it easy. That's the same principle we are talking about thickness of membrane. And now this is another important point, that is effective filtration pressure. We are talking about this since a long time, and let's look into its equation. EFP, effective filtration pressure, equals hydrostatic pressure minus sum of osmotic pressure and Bowman's pressure. Here are three standard figures given for these three pressures for a healthy person. Let's substitute it. Hydrostatic pressure is 45 mmHg, and then you can subtract osmotic and Bowman's pressures sum here, that is 25 mmHg plus 10 mmHg, and then the final answer is 10 mmHg for a healthy adult. This is the effective filtration pressure we are expecting for a healthy adult. The rate is 10 mmHg. Now we have come to the end of GFR and we have studied it very well. Let's just have a quick recap on the two equations we learned from this. GFR, glomerular filtration rate, is calculated by the filtration coefficient multiplied by net filtration pressure. What is the net filtration pressure? Effective filtration pressure is the hydrostatic pressure minus sum of osmotic pressure and Bowman's pressure, and that result is 10 mmHg for a healthy adult. And what was the GFR calculated for a healthy adult? That is 120 ml per minute, or we can say 180 liters per day. And we also learned about the factors affecting glomerular filtration rate. Hope you understood all the topics we discussed here well. Friends, we have completed learning the concept of GFR from physiology. Hope you liked it, and if you feel it is useful, please forward to your friends also and ask them also to share and subscribe. And let's meet again with another important topic. Thank you and see you later. Bye.